Today we're talking about interstitial cystitis. It's a condition of chronic inflammation of the bladder. It's not an infection per se, but it can be another pain generator. They've actually been described as the evil twins, endometriosis and IC. Interstitial, I, cystitis, C. It's not that one causes the other, but again, if you're sitting on a thumbtack and we take it out, you're going to feel better. If you're sitting on 4 or 5 and we only take 1 or 2 out, you're still going to hurt. So what we're trying to do in treating pelvic pain is find all the pain thumbtacks and make sure that we identify them and address them therapeutically, whatever that may be. So with IC, normally part of my intake is using what's called the Pelvic Pain and Urinary Frequency Questionnaire, or PUF score as it's affectionately known. And that's kind of a screening questionnaire for IC. And so in evaluating patients, we use that. And during the physical exam, I'm always checked to see if the bladder's tender. It's all along the front of the vagina. It's right behind the pubic bone and in front of the uterus. So it's pretty close to the uterus. It'd be hard to tell the difference between the two. And as far as treatment, so for diagnosis, during surgery when I'm doing laparoscopy for endometriosis, we'll look inside the bladder. Usually the inside of the bladder looks normal, but we do what's called hydrodistension, which means basically filling the bladder. Like if you're stuck in traffic and your bladder was full and you got in the house, it was like, sorry, I can't talk, I have to go to the bathroom, but you're asleep for this. And often we see different changes, so you can get actual splitting of the mucosa, the inside lining of the bladder, kind of like you can get a little crack in the corner of your mouth that hurts. There's what's called glomerulations. They're like little tiny blood blisters where the capillaries crack inside. That you can also get what's called Huyner's ulcers. So it's a diagnostic test. There's nothing to cut or remove like endometriosis, but trying to identify all the different things that are giving trouble. So that's kind of the diagnosis. There's other ways to diagnose as well, but that's the most humane, I think. As far as treatment, there's different modalities. There's certainly a good number of patients that have food sensitivities or food allergies that aggravate the bladder. There's IC diets that are primarily oxalate based, and it may or may not. Again, I think the thing to do is to do what's called an elimination and challenge. So if you suspect there may be a food or a spice or something that's bothering you or aggravating your bladder, eliminate it for 2 weeks and do what's called a challenge at the end of those 2 weeks where you eat a lot of it, and then you see if there's a flare. So for some people it's a big difference, and often that's the most important step in getting the IC symptoms under control. Again, it's inflammation, so when we get back to the integrative approach, anything we can do to decrease inflammation. So if patients have insulin resistance, that adds to it, and certainly for everybody, the idea of processed foods, often gluten and wheat and all those kind of things that taste good but aren't the healthiest for us may actually aggravate the bladder. And then finally, there are pharmaceuticals. There's FDA approved Elmeron, which is a heparin-like molecule, but it's expensive. You have to take it 3 times a day. And then often we use what's called hydroxyzine. It's kind of like Benadryl. It's a little bit different. It's actually what they call a mast cell inhibitor. So it inhibits the release of histamine by the mast cells. And that's just once at night. And that can be helpful. But the pharmaceuticals, usually we have to give at least a 3-month trial. It can take a while before it starts working. And so there's no cure for it. They're doing research. There's the Interstitial Cystitis Association. I believe it's ICA.org on the web, and that has a lot of helpful information. So another potential cause of pain in patients with endometriosis.